Welcome to this training video for Work Effectively in Aged Care. In this video, we will cover the essential skills every aged care worker must demonstrate to work safely, ethically, and professionally with older people. By the end of this video, you will understand your job role and scope of practice, how to work within organizational and legal requirements, how to apply person-centered care, your responsibilities for consent, safety, reporting, and documentation, and why self-care is essential in aged care work. Section 1. Understanding your role and scope. As an aged care worker, your first responsibility is to understand your job role. Different roles exist in aged care, such as home care worker, residential care worker, community support worker, nursing support worker. Each role has a defined scope of practice. This means there are tasks you can do and tasks you must not do. If a task is outside your scope, you must not perform it. Instead, you refer it to the appropriate health professional, following reporting lines and delegation procedures. Section 2. Working within organizational and legal requirements. Aged care workers must comply with organizational policies and procedures, aged care quality standards, work, health and safety laws, human rights frameworks. Key standards highlighted: consumer dignity and choice, safe personal and clinical care, feedback and complaints, skilled and supervised workforce. You also have a duty of care. This means you must take reasonable steps to prevent harm, respect privacy, and treat every person with dignity and respect, regardless of culture, background, or ability. Section 3. Person-centered care and practice. Person-centered care means putting the person first. You are not caring for a task. You are supporting a person with their own preferences, goals, and life choices. Key person-centered skills include upholding autonomy, supporting choice, respecting self-determination, accepting dignity of risk. Instead of deciding for the person, you ask, "What would you like? How can I support you? And are you comfortable with this?" Even when there is risk, people have the right to make informed choices. Your role is to reduce risk, not remove choice. Section 4. Consent, safety, and reporting. Consent is essential in aged care. Before providing care, consent must be informed, voluntary, clear, ongoing. If a person says no, you must stop and follow workplace procedures. Safety responsibilities. Identify risks. Follow WHS procedures. Use correct reporting channels. You must also be able to recognize signs of abuse, including physical, emotional, financial, sexual abuse, or neglect abuse is subject to mandatory reporting. If you suspect abuse, report immediately according to your organization's policy. Section 5. Documentation and information. Handling. Accurate documentation is a critical skill in aged care. You are responsible for completing reports and checklists, recording facts, not opinions, maintaining privacy and confidentiality, storing information securely. Good records protect the person receiving care, you as a worker, the organization's section. 6. Self-care and professional well-being. Aged care work can be physically and emotionally demanding. You must monitor your own stress levels, use self-care strategies, seek support when needed. Examples: talking to supervisors, using employee assistance services, taking breaks and managing workload. Looking after yourself ensures you can continue to provide safe, high-quality care. To work effectively in aged care, you must understand your role and limits, follow legal and organizational requirements, apply person-centered care, respect rights, consent, and safety, maintain accurate records, care for your own well-being. These skills are essential not only for your assessments, but for your future professional practice in aged care. Thank you for watching, and we encourage you to review your learner guide and PowerPoint element 0104 before completing your assessment. Your